New research performed at the Hip and Groin Clinic in UPMC Whitfield is now published and available in the American Journal of Sports Medicine. In this study, authors Patrick Carton and David Phelan investigate the effectiveness of arthroscopic correction of femoroacetabular impingement for concomitant inguinal disruption in athletes with dual pathology. Here, we take a look at the main areas of this new study. Athletic hip and groin pain can originate from a number of sources, with inguinal disruption and femoroacetabular impingement well recognized and distinctly different pathologies contributing to such groin pain in athletes. The relationship between inguinal disruption and FAI is unclear, and particularly in cases where dual pathology coexists, there is no definitive consensus regarding which pathology should be prioritized for treatment in the first instance. The primary purpose of this study, therefore, was to examine the 2-year effectiveness and clinical outcome in athletes presenting with dual pathology in which the FAI component alone was surgically treated through arthroscopic correction. The secondary aim was to compare 2-year patient-reported outcome measures and the ability to achieve at least a minimal clinically important difference between athletes undergoing hip arthroscopy alone, i.e. one surgical procedure, versus athletes undergoing hip arthroscopy and a groin repair, i.e. 2 separate surgical procedures. Data was prospectively collected and retrospectively reviewed and analysed from an institutional hip registry. All patients undergoing hip arthroscopy for FAI with concomitant signs of inguinal disruption between 2010 and 2016 were considered. Inclusion criteria consisted of male gender, less than 40 years of age at the time of surgery, and those who were involved in competitive sports. Athletes were excluded if they underwent previous hip arthroscopy, if there were signs of advancing osteoarthritis indicated by a tonus grade greater than 1, or radiographic signs of dysplasia where a lateral center edge angle was less than 25 degrees. Once the cohort was established, revision hip arthroscopy or any subsequent surgery was documented. Evaluation of patient-reported outcomes was undertaken preoperatively and minimum 2 years postoperatively, with information captured using Modified Harris Hip Score, UCLA Activity Scale, SF36, and WOMAC. Minimal clinically important difference was assessed using distribution and anchor-based techniques, and the proportion of cases achieving these metrics were established. Finally, satisfaction and return to play rates were assessed. A total of 113 cases among 91 athletes presenting with clinical signs and classical symptoms in keeping with dual pathology were included in this final study cohort. The average age was 26.3 years of age. Almost 80% of cases were competitively involved in hurling or Gaelic football, with the remainder indicating soccer, rugby, athletics, and other as their main sport. All 113 cases underwent FAI corrective hip arthroscopy for symptoms of dual pathology, with hip arthroscopy being the index procedure in the majority, 92% of cases, while the other 8% underwent a groin repair as their index procedure. To address the primary question, the effectiveness of hip arthroscopy alone in managing dual pathology, those cases undergoing hip arthroscopy as the index procedure were evaluated. In 89.2% of cases, no additional groin surgery was required, and hip arthroscopy alone was successful in managing dual pathology. In 10.8% of cases, additional groin surgery was required for persisting inguinal-related groin pain. Evaluation of 2-year clinical outcomes for those undergoing hip arthroscopy only compared to hip arthroscopy and a groin repair revealed significant improvements for both groups independently following their surgical procedures. At 2 years post-op, there was no difference between groups for any patient-reported outcome measures, improvement from baseline, or proportion of cases achieving the minimal clinically important difference. Similarly, the return to play rate and the pain and performance satisfaction rates did not differ whether 1 or 2 surgical procedures were performed. In conclusion, in patients with dual pathology, treatment of the FAI component alone using arthroscopic hip surgery results in successful outcome without the need for groin repair in 89.2% of cases. Additionally, there is no statistically significant difference in clinical outcomes 2 years after surgery between athletes undergoing one procedure, hip arthroscopy alone, or those undergoing 2 procedures, hip arthroscopy and groin repair at any stage. The full details of this study can be accessed through the American Journal of Sports Medicine. Thank you.